Hello, this is Dr. Lakshmi H. Shetty. I'm an interventional cardiologist working as Associate Professor of Cardiology at Sri Jayadeva Institute of Cardiovascular Sciences and Research, Bengaluru, Karnataka. Today, I would like to extend a warm welcome to the dignitaries participating in today's forum on Time for Action with Healthcare Leaders on the occasion of World Heart Day 2021. We have Professor Dr. J.A. Jayalan. Sir is a distinguished laparoscopic surgeon, also professor of surgery at Tirunelveli Government Medical College, Tirunelveli, Tamil Nadu. Sir is presently serving as the national president of the Indian Medical Association. We have Dr. Rishikesh D. Pai. He is a leading obstetrician and gynecologist, also a pioneer in the field of infertility and IVF. He is the director of the Bloom IVF Group and presently the president-elect of the Federation of Obstetric and Gynecological Societies of India, FOGSI 2022. So we have Dr. P.S. Banerjee, an interventional cardiologist as well as a cardiology teacher with more than 30 years of experience. He is the ex-professor and HOD at R.G. Kar Medical College, Kolkata. He is the president-elect of the Cardiological Society of India. We have Dr. Kamlesh Tiwari. Sir is a well-known physician and teacher. He is the ex-professor and HOD of the Department of Medicine at SK Medical College, Muzaffarpur, Bihar. Sir is presently the national president of the Association of Physicians of India. Cardiovascular diseases top the mortality list with a staggering 18.6 million deaths per year across the world. The situation is no different in India. And cardiovascular diseases also contribute to maternal morbidity and mortality along with hemorrhage and sepsis. Now, conventional risk factors like smoking, diabetes mellitus, hypertension, obesity, stress and air pollution play an important causative role. However, stress and air pollution are gaining more importance, especially in younger patients who are presenting with the coronary heart diseases especially. And obesity and sedentary lifestyle are gaining importance in the present COVID-19 pandemic era. Dr. J.A. Jayalan. So now with the World Heart Day around the corner, I request for a few words from you, sir.
Respected colleagues and the viewers of this program, on behalf of Indian Medical Association, I take this opportunity to appreciate the efforts of everyone for observing this day as a World Heart Day, in which we are trying to bring awareness about the cardiovascular disease and also putting forward the ways and means by which that we will be able to overcome the onslaught of these cardiovascular diseases. We all know one of the most important thing every doctor in this country will now advise is a lifestyle modification. Certain characters and the lifestyle which we are adopting, whether it is a smoking, alcohol, or the obesity, or the junk foods, are going to be the most important, potent, the lethal, the inducer of the cardiovascular efforts or cardiovascular diseases in our country. But you must also remember, less than 40 years of age, we are also now seeing a lot of people with the cardiovascular disease coming to us. Maybe they are teetotalers, they do not have the habit of alcohol, they do not have the habit of smoking, but all of them have one common factor, that is a stress. And there is a continuous working pattern or the not having an adequate relaxation in their life, or the sleep deprivation, or the inappropriate lifestyle which they are adopting. So all that leads to, when they are not able to meet out the demand, that they are entering into the life of stress, and that is going to be causing being the killer of their heart and their life. So now we need to focus exclusively on this young generation of the people who are getting the cardiovascular, in which then we need to teach them art of life and have not only the virtuous, the vices or the bad habits, but also their planning within their working pattern, that how they will be able to change their life to that. One of the factor I always used to teach my students and my association is love yourself. And the many times, and at the pretext being a doctor or in a people, we always say that I do not have time for myself, but I spend my time extremely for others. That is not going to help you. If you are not ready to love yourself, if you are not ready to love your heart and adjust your life according to the needs of your lifestyle, and you are going to be in a very, very difficult situation. If you are not loving, no one else can save you. So I appeal to you at this World Heart Day, have exclusively time for you to relaxation, very pertinent role for taking care of your body. Do not worry about too much about what is going to happen for the external world, but try to concentrate on yourself. And only when you are able to do something good to you, you will be able to do something good for others also. So I appeal to you to take care of your life, be cautious of it, but do not be worried. Be sincere, but do not be serious. If you are serious, you have to be in ICU. If you are sincere, you will be definitely enjoy your life. Thank you very much for this opportunity to greet you and invoke you to adopt to a healthy lifestyle to save our heart, and thereby that we can able to extend our helping hand to the society in which we are living.
True, sir. True, sir. Sir, actually, control of risk factors, as you mentioned, definitely plays a very important role in the management of cardiovascular diseases. Sir. But we often face numerous roadblocks like denial of diagnosis by the patients, social stigma, compliance issues, and follow-up issues. So, thoughts on how we can make a difference with any health programs or anything like that, especially, as you said, concentrating on the younger generation, because it's always believed that cardiovascular diseases are diseases of the elderly.
No, I fully agree with you, but only thing the social stigma is very less for cardiovascular disease. If the society, if someone is saying that I have a hypertension, he is always considered as a big man, and people are very happy to say that I have done a stent, I have done a transplant, because always that was considered as an elite people are getting that cardiovascular disease. But the problem which lies definitely in the lot of social media factors and lot of Google's WhatsApp message, which comes to them and say that if you have a pain in the chest, invariably it is only the gastric pain or the food they had before that, or the false beliefs and the misconception or one which is not allowing them to come to the hospital and take the risk. Most of them believe if they are young, they will not get a cardiac disease. And most often when they have some food allergy or the food, inappropriate food they have taken, they attribute that to the food and other diseases, and they are not able to presume that it is a cardiovascular disease and cardiac problem. So the concept of coming and in consulting with the particular doctor, it is blocked because of their mental inoccupation or the occupation which says that they are not prone for the cardiovascular disease. So that myth we need to conceive. Everyone can have that. And second thing is periodic analysis and investigations. If someone is having the habit of familial cholesterol disease, and definitely here they are more prone, so they have to be more under control. And periodic examination of their hypertension and the blood sugar has to be there, because all this is definitely going to add, and the lifestyle modification has to be this. So as on date today, we have the facilities, we have opportunity, because almost every nook and corner, the taluk hospitals or the private hospitals are there to make the people understand and estimate their cardiovascular risk and the problem. But the information which they are getting, there is no trials. Like vaccine, we say the first phase, second phase, third phase trial, but social media message, we do not have the trials for that. So some message reaches them, coconut oil is good. The next day, another message goes to them, coconut oil is bad. And cholesterol is good or bad. So there's a lot of misconception is there. So the cardiologists and the cardiologic societies should come forward, and we should find out some mechanism. Probably Omnicuris can also help us in that, whereby we will be able to give them the appropriate, the valid scientific data, scientific truth to the way it is reaching them. Most of the time, we doctors, we are not ready to come out and openly say that this is a fact, and that is why the unscientific facts are mushrooming. So on this Heart's Day, I appeal to the Cardiac Society to find out some mechanism where the correct picture. I know it is very difficult for the cardiologists to accept the facts together, but a consensual fact to come out, and when we reach out to the public, that will be much better for us.
Dr. P.S. Banerjee. So now with the World Heart Day around the corner, I request you for a few words. Also, coronary artery disease is on the rise in Indians, and the average age of first MI has decreased by nearly 2 decades in Indians. Now, your viewpoint on this?
The early disease detection below the age of 40 years is very, very common nowadays, because of the tempo of the life has been changed, the lifestyle has been changed, the food habit is changed, and the patient also usually under huge stress, sitting on the chair, working 10-12 hours a day, and eating a lot of junk food, smoking, consuming alcohol, and not caring about the body weight. At the same time, they are developing the high cholesterol level because of the lack of activities and healthy diet. Moreover, there is often a familial predisposition, that is the genetic predisposition of the disease when the early heart attack occurs below the age of 50 years in either father or on mother, and that can lead to the high risk of heart attack below the age of 40. So thereby, you have to be very careful in detecting those patients that who are having this kind of risk factors, and to detect them early, to diagnose them early, and to treat accordingly, along with the lifestyle modification to prevent heart attack at the age of 40 or below.
The control of risk factors play an important role in the management of cardiovascular diseases, but we often face numerous roadblocks, as in denial of diagnosis, compliance, and follow-up issues. So thoughts on how we can make a difference with this?
The risk factors, yes, there is a roadblock because of the lack of awareness among the people and the education at the same time. So you have to use more and more the social media, the electronic media, the newspaper, and different apps now being available at the cell phone, to use all these gadgets to improve the awareness about preventing the disease, particularly in the remote areas and the less educated people who doesn't know that how to take the preventive measures to prevent the heart attack. So that is how the awareness has to be increased, and the use of the telehealth is very important. So online different CME courses or different this type of preventive courses, or the meeting can be arranged so that the people at the remote area can follow this meeting and understands how to prevent the heart attack in the population by correcting the risk factors, as I already discussed, like high blood pressure, diabetes, obesity, high cholesterol, sedentary habit, bad food habits, and also the presence of family history of early heart attack in either of the parents. So these are the most important risk factors which has to be discussed, even either in the physical mode or by virtual mode, so that they understand how to take the preventive measures and thereby preventing the risk factors and preventing the heart attack.
Dr. Rishikesh D. Pai. So now with the World Heart Day around the corner, I request for a few words from you.
Hi, I'm very happy to be here. And, it's World Heart Day is celebrated every year since 1991. It's done by the World Heart Federation, and they are a conglomerate of more than 200 plus various NGOs and societies. And every year this is celebrated to focus on heart disease. And actually, heart disease has become a real problem. Nearly 18 million deaths in the world occur due to heart disease every year. And you'll be surprised because we always think that heart disease is more common in men, but in India, it's the number one killer amongst women as well, especially in postmenopausal women. There's a very high incidence of heart disease leading to mortality. So it's very important that we focus on this, and it's very preventable. In nearly 70%, you can prevent heart disease, especially in India, where we have a very unhealthy lifestyle. We have obesity. And even amongst a lot of people now, smoking has become a more problematic issue amongst women. Then you have lack of exercise, and then it is compounded by, we are all diabetics and hypertensives. So it's an ideal culture ground for having heart disease. So it's very important that we all focus and strive to reduce this problem in our country as well.
And the next question would be, talking about females, how do we improve the maternal outcomes in a patient with preeclampsia or eclampsia, that is having a multi-speciality approach?
So it's very important to understand that the answer lies in the prevention rather than in the treatment. And, it's very important to make them fit, because I would like to focus more on the prevention aspect. We need to educate them right at the beginning. And so preconception care is very important. Proper diet prior to getting pregnant, trying to reduce their dependence on salt, because salt is a big problem and a component of the Indian patients. So that's very important, as well as trying to give them better lifestyle before they conceive, so that there is a decrease in the incidence of diabetes and hypertension. using green leafy vegetables, high fiber food, low in carbohydrates, high in protein, especially like a Mediterranean diet, so that will really, when they actually become pregnant, correction of anemia, all these will contribute to a very improved outcome during pregnancy. So if you right at the beginning have a good lifestyle and a good diet, then your chances of developing hypertension and preeclampsia is going to be reduced during pregnancy. Of course, in a pregnancy early diagnosis, there are a lot of now new techniques that have come in where we can use them for early diagnosis of hypertension, and we can also do prevention by giving them early starting of aspirin, especially 150 milligrams of aspirin, and then picking them up early, trying to treat that hypertension as soon as it's noticed is very important. Especially our country, we have 26 million births. So a lot of births take place in urban, in rural as well as tribal areas where institutionalized delivery is not possible. Of course, Government of India, along with the Federation, the FOXI has done a lot of work in implementing the Pradhan Mantri Surakshit Matrutva Abhiyaman, which is called PMSMA scheme, and using that scheme and trying to train the ASHA workers. We have nearly 10 lakh ASHA workers, so we need to use this force and this paramedical force to identify patients with risk factor, and not only that, to identify pregnant patients who are developing early problems, pick them up and refer them to tertiary care centers so that they can be effectively treated. Not only that, we must also screen them for diabetes, which is also a big problem and which can develop during pregnancy and post-pregnancy. Also, we must monitor many of these PAIH patients. They need to be monitored to see that they are not going into chronic renal disease and they are not going into diabetes after the delivery as well.
We have Dr. Kamlesh Tiwari. So now with the World Heart Day around the corner, I request you for a few words on this.
29th of September is World Heart Day. Every year we celebrate this day for the prevention of heart diseases. Actually, this year, due to corona pandemic, patients are not reaching to the doctors. So what we thought that connect to heart, that was the slogan for this World Heart Day. Connect to heart. I will connect through mobile, internet, and other telemedicine connections so that patient can be benefited with this telemedicine. The main purpose is prevention of heart disease. And for prevention of heart disease, there are certain guidelines. And most important is lifestyle modification. So how we are going to prevent our heart? Follow the lifestyle modification. In lifestyle modification, important things are diet, exercise, stop tobacco, abstinence of alcohol, and don't do very bad things like excessive work or less sleep. Those things are also harmful for the people. Regarding diet, the main concept is to reduce the content of fatty things because it increases the cholesterol level in the blood. So what type of fat should be reduced? It is saturated fat. The fat which is solid on room temperature should not be taken, at least not in more amount. It should be taken in very minimal amount, roughly 10% of the whole diet. So saturated fat, very less. Don't take trans fat at all. Trans fat means the fat which is used for frying the things again and again. That is trans fat, and that is strictly prohibited for any use like chips, potato chips, and children taking this. I don't remember the name, but kurkure and those type of things. Please avoid those things. Don't use trans fat at all. And what should we use is green vegetables and fruits. That is the most important thing in taking food because those green vegetables and fruits contains all vitamins and minerals, and they contain also carbohydrate, protein, and fat. And that fat is not harmful. That fat is good for human being. So take plenty of vegetables, green vegetables, and fruits, and amount of carbohydrate and protein is reduced. So 40% of our diet should be green vegetable and fruits. Fat 10 to 15% only. Protein in the form of pulses, chickens, fish we can take. And carbohydrate, avoid sugar as much as possible. So avoid sugar, avoid salt for healthy life. So these are the main tips for diet. Second thing is exercise. Well, exercise is very important because if diet and exercise is sufficient, it will cause reduction in the weight. That is very important for heart disease patients. So exercise, which exercise, how much exercise, that is a big question because every patient can't do exercise. A person of 80 years can't do much. So exercise is fixed and consult your doctor, but roughly 45 minutes walking is the best exercise for most of the individuals. Above 45 years age, till above 45 to 85. So either 45 minutes walk at least 5 days a week or 30 minutes walk daily, that is sufficient and that is enough for good health. Other form of exercise, if you can do, is cycling, swimming, horse riding, and whatever available to your part should be done and which should be easy for you. The heavy exercise, that is also essential, though it is harmful as well. But weightlifting exercise can help, but you should consult your doctor before doing those type of exercise. Regarding smoking, that is very bad for health. So don't smoke because it causes coronary artery constriction and increase in the heart disease. So smoking should be avoided. Regarding alcohol, it is controversial because these guidelines are formed in England, and in England it is very difficult to stop alcohol. So what they have made, take alcohol little bit, 1 or 2 peg, hardly 30 ml alcohol should be allowed to heart patient. Reason they have given that alcohol increases the HDL level. It is a kind of fat which will reduce the amount of LDL fat, which is bad for health. So increase in LDL and reduction in HDL is a part of alcohol. That's why they have said that take alcohol in limited amount. And other things, sleep, that is very important. Every person must take 7 hours sleep. And stress, avoid stress as far as possible. Well, it is not in our hand, but try to avoid and remain stress-free. That will help in the heart disease. The main factor for causation of heart disease are nowadays diabetes, hypertension, and obesity, and increased cholesterol level, lipid abnormality. Well, if patient is diabetic, chances of heart disease is more. To try to control the diabetes as good as possible is the main thing, and try to reduce the glycemic hemoglobin in the normal range. Well, for diabetes, there are certain rules. Don't take this, don't take sugar, don't do exercise, same thing. But carbohydrates should be restricted mostly, and carbohydrates which should be taken in the form of fruits. So don't take direct sugar or direct sweetener. Control your blood pressure. That is also most important thing. And for control of blood pressure, same guidelines are there. Reduce weight, exercise, diet control. For hypertension, diet is called DASH diet. DASH diet means take less sodium and high potassium. So that DASH is recommended for hypertension patients. And try to control hypertension with this lifestyle modification, stop smoking, take a small amount of alcohol. And obesity is the main cause of many of the diseases. So try to avoid obesity. And to reduce the obesity, it is exercise and diet that is important. If you will control your exercise and diet, obesity will naturally decrease, and that will help in cessation of all diseases.
Coronary artery disease is on the rise in Indians, and the average age of the first myocardial infarction has decreased by nearly 2 decades in Indians. Your viewpoint on this, sir?
Yes, coronary artery disease is increasing, there is no doubt, because the incidence of diabetes has gone up. Doctors are trying to do their best to reduce the incidence of diabetes, hypertension, and obesity, and we are working on that.
Dr. J. Jailan. Sir, those specialty services actually provide best care and also approach to the patient. We find that the holistic approach to the patient is actually gradually dwindling somewhere in this process. So how do we bridge this gap, sir?
This is one of the very great concern what we are facing there. If you see the family medicine concept, which has been, the India was a cultural place or the birthplace of the family medicine concept. Now Western countries are adopting it, but we have forgotten that. And everything we are now trying to make organ-centered or a focused approach. Indian Medical Association very consciously working on to bring the concept of family medicine into the minds of the people. There is two things are there. One is a family medicine as a specialty. That's only we are going to have a specialist of this one. But I'm talking about the concept. The concept of family medicine is looking after them in a holistic way. Their environmental situation, their childhood, their family. So everything has to be looked into that. So that concept, whatever the specialty we belong, even the super specialty belong, we should have the culture and concept of the family medicine. And if that we have, definitely that we will be able to do more. But that needs a lot of work, lot of sessions to be done. The Indian Medical Association is very consciously we are working on that. The integrated approach or the family medicine concept approach, where we are going to see in a person in a holistic way has to become. It is difficult for a doctor who is or a cardiologist who is working in a very big centers or the corporate center, where we have the people coming into the one particular section, and if they have to have a multiple consultation, their cost is going to be escalated. The investigation charges are going to be high, and finally the patient will be get disillusioned. But in a small level Taluk hospital or a district hospital, a comprehensive view has to be applied, and cardiologists also should come out with the community-oriented cardiological care or the preventive cardiology, which will be definitely helpful us in ensuring that everyone is getting an appropriate overall thorough examination and an overall picture of the disease is being given to them.
Dr. Rishikesh D. Pai. Next question. Though the specialty services provide the best approach and care, we find that the holistic approach to the patient is slowly dwindling. How do we bridge this gap?
So I agree with you that because the problem in India is that we have huge amount of births, nearly 26 million. That's more than population of many countries in the world. So we are looking at a big problem. However, over the last 70 years, we have done tremendous progress. The government, in association with the federation and the professional bodies and other NGOs, as well as the central and state government, all of us have come together, and things are really changing. We are getting nearly close to the developmental growth. The maternal mortality, perinatal mortality has started falling down, and it's a really, unfortunately, the COVID was a big hurdle for us in this progress towards better care for all men and women and children of this country. However, despite of all that, we are slowly moving towards better achievement of the developmental goals. And one of the things I would like to focus on is our federation, which has started the Foxy Manyata program, which is to upgrade the maternity and nursing home, we have nearly done it for 1,500 maternity homes. And in this program, we have 16 clinical standards, and we train them. We give them quality improvement sessions, and after that we take a quality assurance exam. And in this, there's a totally integrated approach, not only in terms of physical approach, but also what is known as respectful maternal care is also incorporated in it. So we are all looking at the woman in a very holistic fashion now, and slowly this movement is taking momentum now, and our target is 40,000 maternity. But the greatest, I would say, the successful ingredient of this program is this voluntarily we are making them. See, we can do it in an involuntary fashion. Just the government has to put just one order and say you have to follow a particular format. But we would like doctors to do it in a democratic and a voluntary fashion on their own to improve themselves. And once this happens, all these variables and parameters which contribute to better healthcare, all this integrated approach should come together. And this is what is my theme as Foxy president of next year. My theme for the Foxy, my slogan for Foxy next year is technologies transforming women's health. It's very important to understand that all technologies, digitalization, and if you look at this year's World Heart Day theme is on connect. Connection is very important. Digitalization, connection, reaching the masses, and the biggest tool to do it is through the mobile phone, the Android. This very important weapon that we have got, and this is going to really transform healthcare in our country.
Dr. P.S. Banerjee, though specialty services provide the best approach and care, we find that holistic approach to the patient is slowly dwindling. How do we bridge this gap, sir?
Yeah, we have to see the patient not only as a patient, but we have to address the patient mental health also before we start treating the disease. Now, when you start treating the disease at the same time, to find out with the discussion with the patient that what is his belief, spiritual belief, or his liking, like music, reading storybooks, watching TV. All these things have to be discussed so that during the hospital stay, you can give the treatment both for the improvement of the disease or curing the disease, at the same time to address the mental peace or mental happiness of the patient during the staying period in the hospital, so that he can get an all-around care with the disease as well as his mental health and peace. That is how you can manage.
Dr. Kamlesh Tiwari, centering on our World Heart Day theme, use heart to connect, that is on digital health, how can it be translated in our country as we still do not have a robust digital platform?
Well, physicians and cardiologists, actually, there are no much difference because we are Indians, we are living in village. So we can't get cardiologists everywhere. Most of the part of India is filled with physicians. So first doctor is physician. So if patient is coming to the physician of a heart attack, he will manage the case as far as possible. And in periphery also, we can do the management to certain extent, even thrombolysis therapy, and in certain places, even percutaneous angiography as well. But if things are more severe, then we refer the case to the specialist center for more vigorous treatment. If required, maybe bypass surgery.
Dr. J. Jailan, so, centering on our World Heart Day theme, sir, the theme is use heart to connect this year. So it's mainly on digital health, but how can we translate it in our country, because we still do not have a very robust digital platform. So with whatever available, what are the possibilities, sir?
Yeah, now the digital health mission is coming to play a major role in the government, and tomorrow our Honorable Prime Minister is going to inaugurate the National Digital Health Mission vision. We just gone through that with the government, their robust system in which they are going to control. And their doctors are going to become the universal ID, and patients are coming into the system. It is a very big, robust system. Government of India is trying to bring it. Yes, it will have some initial or the hiccups will be there, but definitely with an available system which is now, is percolating in the aftermath of the corona, or which has even definitely revolutionized the digital platform available, which has crossed the geographical border. I am looking at it very positively and optimistic on that mission. Very shortly that we will have a boon on that digital platform to reach the people in a way. But the only problem will be have, once again, I will be emphasizing that there will be junk of information, or the jungle of information will be there. But whether it is an appropriate or censored, and that all the associations and the senior people has to play a role. Somewhere we need to be as input or the control or the message how it is going to reach the people.
Dr. Rishikesh D. Pai, also focusing on females again regarding valvular heart disease, especially mechanical prosthetic valves and pregnancy and peripartum cardiomyopathy. How can we smoothen the management issues between the various specialties, especially cardiology and obstetrics?
So, as I told you that the healthcare is divided into urban, rural, and tribal. These are the three components. And I think in urban care, we are already integrated. So most of the urban, if at all we pick up a cardiological problem, and we must, as a rule, auscultate a woman. It's very important. A little murmur or any of these issues can really make a major difference in the pickup, because we have to pick up the heart disease also. So we normally don't like, when a pregnant patient comes, you don't focus on the heart. You would normally focus on the blood pressure, and maybe if there's a blood pressure or a family history, you would pick up. But I think it's important to put a stethoscope on the pericardial region and look for a murmur. So this is very important, simple thing that can really pick up a lot of heart disease. And once we pick it up in an urban area, we have no issues at all. We will refer them to the cardiologist, and there is a definitely integrated approach between the physician, the cardiologist, and the gynecologist, and sometimes the cardiac surgeon if there is a need for surgical intervention. The main challenge lies in our poorer patients where rheumatic heart disease is a big problem. Of course, you have to catch them young. You must give prophylaxis so valvular damage is prevented. And now we have got a lot of very skilled surgeons, a lot of non-surgical interventions that can really overcome many of these problems. But we need to educate the ASHA workers. So we have to develop some kind of point of care system wherein we can maybe an electronic stethoscope or something where an ASHA worker can put it on the chest and it can pick up, or we have many of these new Android applications that come where you just put a finger, and I don't know how effective they are, but you can put a finger and they at least will give you a heart rate. And there may be some amount of pickup that can be done as far as the cardiac disease is concerned. So in those areas which are inaccessible, and India, the challenge is the access. The last mile is the challenge for us. And I personally feel that instead of creating infrastructure in the last mile, it's better to pick them up and create a transport structure where they can be re-transported back. And I would like to put in a point here that many of in United States, which is 3 times larger than India, the transportation is done by many areas by trailer. So the trailers are well equipped to do a lot of emergency care. So they will go to a very distant, remote village and they will put the patient, and as they are transporting the patient in the trailer, they can treat the patient in the trailer. So I personally feel instead of creating infrastructure which becomes redundant, what the ministry should do is to create the roads, which our transport minister is already doing. So create the connectivity and then use our transport system to bring back those patients to the district level hospitals, rather than creating primary health centers, which can be very difficult to staff them, to maintain them, to run them. We should have this transport system, and this will help us not only in cardiac disease, but in all kinds of diseases. So a combination of digitalization, using the end point worker like the ASHA worker, educating them through digital and transforming them through digital education, using tools at the point of care to pick up various problems such as heart disease, anemia, blood pressure, diabetes, pick them up, transport them. Transportation is very important. Bring them to the district hospital, and support system is also important. You just don't bring them and leave them. You need to get them treated, and you need to transport them back to their tribal or rural environment where they are comfortable. See, when they come to district hospitals, they come to cities, they are uncomfortable. So this is a big network that has to be created by our medical fraternity, by our NGOs, our voluntary associations, governments, both at the central and state level. So according to me, all this is coming together. The digital health will galvanize us, integrate us, and will be able to effectively implement policy in the future.
Dr. P.S. Banerjee. Now, centering on our World Heart Day theme, use heart to connect, that is about digital health. How can it be translated in our country as we still do not have a robust digital platform?
There is nowadays a huge discussion on artificial intelligence and the digital health or the telehealth. And I think as the days will progress, the months or years will progress, there will be more and more use of the digital health as well as the artificial intelligence to use this platform in diagnosis and treating the disease, and particularly in the remote areas where the patient cannot reach to the tertiary care hospitals, and you can take the symptoms of the patient over the digital health and use the artificial intelligence so that you can give the advice to diagnose and what to do at home, and whether this patient requires to be transferred to the hospital, and how fast you can reach to the hospital to institute the treatment. So where the facilities for tertiary care is not available, so that is how the digital health and the artificial intelligence can be utilized to early diagnose the disease and give the appropriate advice for hospitalization or treatment at home when it is possible to carry on.